tragic incident of two engineers who lost their life during a hair transplant surgery in Kanpur.
See, hair transplant basically it's a very safe, but
Sir, in Kerala also recently one incident happened, right?
so in Kerala, what happened? The person was already diabetic, and
What could cause this infection, sir?
the procedure was very prolonged.
Ma'am, what about our AFT 2.0?
Basically, what is AFT 2.2?
Hi, I'm Dr. Lima, maxillofacial surgeon at VCare Hair and Skin Clinics. Today, joining with me is Dr. Chandrasekhar Singh, dermatologist and celebrity hair transplant surgeon, and Dr. Divya Bharati, maxillofacial surgeon and senior hair transplant surgeon at VCare Hair and Skin Clinics.
No, sir. Definitely would have come across this tragic incident of two engineers who lost their life after doing a hair transplant surgery in Kanpur. And what could be the possible cause of the death, sir?
See, hair transplant basically it's a very safe procedure, but these things actually happened in Kanpur, and one case happened in, I think, in Kerala
Yes,
also.
sir.
And both the cases, if you correlate,
Yes.
it was main reason was the prolonged period of the surgery, and plus the infection was the main cause.
So what could have caused this infection, sir?
Exactly. So what happened, basically what we have read from the news and the chats which came into the media, the procedure was very prolonged. Right from the morning, they have completed the procedure up to the midnight. So if the procedure is prolonged for so many hours, but if you are doing surgeries for 12 hours, 16 hours, 18 hours, so in between the surgeon also goes out, the assistant goes out, and he opens the door, and that sterility which was maintained due to the fumigation and fogging other methods, that goes down. So the chances of infection goes higher. So because of this, means these things also should be taken care, that the surgery period should be not more than 4 to 6 hours.
What could be the cause for this prolonged surgical? Was that experience of the surgeon
Yeah,
qualification?
definitely. This matters a lot, because if you are properly trained, you are trained in such a way that this number of graft has to be extracted, and this is the way how it has to be extracted. Each and every graft should be handled properly, and then it has to be implanted in such a way so that minimum mechanical trauma is there. So this affects the results. So if it is not means if they have not done the training properly, the consequences, if suppose the surgery is prolonged, so what will be the consequences?
Like too
So
much
all this
manipulation of tissue.
exactly. If you see the means in the undergraduation, there is a long process in 4 years, 5 years. We see how the patients are taken care. We go into the surgical OT, the gynec OT, the cardiac OT. What is the importance of sterilization? So here what happened, if suppose nowadays a lot of doctors who have not even gone into the OT, they have also started doing electropathy. Doctors are there, and Ayush doctors are there, and there are so many people. So aesthetic is such a thing that so many people are involved in this. They think that it's a very simple procedure, but if you are doing some surgical procedure, if some intervention is there, definitely the surgical techniques has to be taken care, and it has to be a part of your the procedure.
Yes, sir.
Yeah.
Like how many grafts can we safely extract during
So
a day, sir?
usually 2000 to 2500 number of hairs and number of grafts, or 5000 follicles.
Yes.
So this can be extracted safely, and it is implanted, and it can be implanted. So the shorter the time the graft outside the body, the better will be the
Yes, sir.
results.
What happens if we overshoot, sir? Like if they plan for like 4,000, 5,000 grafts, like 9,000
So
hairs
yeah,
in
we
a day?
can divide obviously into 2 days.
Yes, sir.
We can just
Like I guess
split into
that
2
was
days.
one of the reason in this Kanpur
Yes,
incident. They
that
have
was one of
overshoot
the
the
reason.
yes, sir.
And plus there was the doctor actually, when the person was having lot of, so what happened if you do lot of more number of grafts, if more number of grafts is there, then the issue comes that the person will be giving lot of tumescent.
Yes, sir.
And when tumescent is there and slowly, and if the graft is exposed to the air for longer period of time, and there was some space, infection also happens, and then it slowly goes into the deeper tissues, and slowly that infection happened. She might have given antibiotics,
Yes.
but she didn't give antibiotics. In spite of the antibiotics, she there was some news channel was telling that they have given some Lasik. Lasik
Yes,
is a
sir.
diuretic.
Yes.
So that was
To
not
reduce the swelling,
exactly
they have given.
that was not the proper way to proceed with
To
that. And she had referred to a cardiologist also, and he told that the ECG is normal. But the actual thing was that it might have done in a proper way, and then this 2 lives might have saved.
So basically, this incident happened due to the inexperience of the surgeon, non-sterile OT setup,
Exactly.
prolonged working hours,
Yeah.
and this all has triggered the infection. And this infection was not treated in a proper post-operative care.
Exactly.
This have triggered the incident.
There was one more case also 6 months back.
Yeah, the same clinic had 2 cases.
Yes.
Sir, in Kerala also recently one incident happened, right? So what could be the reasons for that?
So in Kerala, what happened? The person was already diabetic, and what I came to know, he was a dietitian and he was not taking anti-diabetic medications. And the doctor who came for the surgery was from Hyderabad. He used to perform the surgery and go back. So there was basic staff where nursing staff used to be there. So what happened? But basically, this fellow, he was already on diabetes. Plus, when he started getting pain and swelling on the next day, which was very uncommon, we can say, but it happens sometimes. So the staff from the clinic, they thought that it is the routine pain, but there was already high blood sugar level, and they give steroids, which shooted the glucose level. Because the glucose level went higher, the immunity decreased, and the chances of streptococcal infection also increases. And this is very common in diabetes. People develop necrotizing fasciitis, mucormycosis.
So the key incident is like diabetes. The key factor
Yeah.
of the entire incident is they have not considered diabetes
Yes.
as a factor.
So if they might have considered diabetes and they might have treated it well, then this might not have been happened, because the blood sugar went very high, and the immunity was compromised, and then later on he developed necrotizing fasciitis and a lot of severe muscle, means it is called as a flesh eating bacteria. So the muscles were lost in the frontal area, and then he went to the hospital. He went for multiple surgeries. He went, and from the thighs, they took flaps from the thighs and they have covered those areas. So it was, you can say it was a life-saving thing for that fellow.
Sir, so how could we prevent both the incidents that has happened in Kerala as well as in Kanpur?
See, Lima, this is a very tricky question. It's a very lot of things has to be taken into consideration. For example, the OT setups, the techniques, the doctor who is performing the surgery, plus how you preserve the graft, how you respect the graft while implantation. There are so many things has to be taken care. Many times what happens, the person doesn't know what are the surgical, they just know that hair transplant has to be performed.
Many of them come just like we are fixing the hair kind of thing.
But this is not the case.
Yes, sir.
Actually, it's a surgical procedure. And many times what happens, suppose a doctor is there, he has given franchisee to some non-medical person. He is running the show in some small cities, and some doctor might be coming from some other places, and the workload has increased so much now. When the doctor who is trained, he is busy, he might send his assistant to perform the surgery. This is what happens. And sometimes what happens, these franchisee people, they don't know what is OT setup, and they just know that we have to consult
they
a
have
patient.
a room, they have a bed, light.
Exactly.
That's it.
This is what
They don't
thing.
even maintain the temperature
But
of
we
the
are
glands.
we are extracting follicles. It's like a plastic surgery. You are transferring the grafts. So during this process should be sterile.
Yes, sir.
If there is a break in the sterility somewhere,
Yes, sir.
Then-
They didn't like they think eye surgery, transplant, heart transplant is very important. Equally, hair should be sterile, but they think that is like you can take, keep. That's all.
yes, it's not like that. So surgical OT should be it should be very important. There should be proper fumigation, and sometimes what happens, there are windows in the OT.
Yes.
And glass are broken. there are gaps in the OT windows, and they tell that fumigation is done, but how it can be sterile? Plus, what happened? Many times they don't even do fumigation also, because they don't know its importance.
Like how much surgeon is important, equally the OT team is also important. The assistant should also be equally trained. They should know like how to handle the graft sterile way. They should maintain the temperature of the graft, like it should not be kept in a plate in an open room. It should be like maintained at 4 degrees Celsius throughout the procedure. Like you cannot have it for a longer time. There should be like there is a particular timing that it should be out of the body. So how much ever the surgeon is important, the team is also like equally important.
So in Kerala, what happened? There were a few incidents of infections, boils coming on after a month of the surgery, after a month, 2 months of the surgery. So these similar type of infections used to see in surgeons who used to carry their endoscopes.
Okay. So this is where this post-operative care comes into role. Like not if you can finish the surgery, just leave. Yes. After 1 month, the infection is occurring. So like the patient. So
after 1 month, 2 months, some people will find some bubble coming on some boils coming here.
So post-operative care is like should be for at least 6 months after the transplant.
The tragedy is this: they will go to some doctor, local doctor.
Yes.
The local doctor will think that it's a normal boil. They will pierce it.
Yes.
When they will pierce it and remove the content, but they will not.
You have to break the cyst to
cyst. Yeah, you have to break the cyst. Plus, the person should be on antibiotics,
and it will also recur.
So what happens when you break it and when you don't clear it, and the person is not on antibiotics, the chance of secondary viral infection comes into action, and this goes on. This goes on for months.
Yes.
And there was one clinic in Kerala only, Cochin. So they have back-to-back similar infections in 7-8 patients. So this is a common thing. So then those people who are not getting treated with these two combination, then there was amikacin injections which was given locally. So that also has helped a lot.
Sir, thanks to social media, we have so much knowledge about male hair transplant. Either it's right or wrong. We have so much information on social media regarding male hair transplant. Regarding this female hair transplant, sir, or females are a candidate of hair transplant, sir?
See, most of the cases they can do it. Usually, if a female pattern hair loss is there, where they have less hair in the partition area or in the center portion, in those areas we can do hair transplant. But suppose if a female is suffering from alopecia areata, SLE or some autoimmune diseases, so we should try to first cure those things, and after that we can do it if the lesion is not active.
Okay, sir.
If it is not active since more than 2 years, then we can plan for that. And plus in females we don't need to trim.
Yes, sir, that is a huge myth existing.
Exactly.
For transplant itself, we do a complete shave.
Yeah, in males usually people always think that transplant means you have to shave.
Yes, sir.
So
for
in females we can do zonal trim.
Yes.
In the safe donor area we can do a small zonal trim.
That we can cover with the existing
exactly
hair.
The upper part of the hair will cover that zone, and she can make pony and everything. She can do whatever she wants, and will not trim in the area where we are going to implant
transplant also. So it's typically no trimming.
Yeah.
Ma'am, what about our AFT 2.0?
Yes, we have launched our new techniques, AFT 2.0, which is completely different from our traditional HT method.
So basically, what is AFT 2.2?
So we have customized everything right from the punch. We are using a very smaller size punches, like 0.8 punches, so that the scar will not be visible. It will be making the scar very precise. So even if the patient trim after the procedure, 1 year after the procedure, the scar will be very less visible. And also we have changed the preservation medium of the graft, sir. Usually what we use in traditional hair transplant, we have changed the solution so that the survival of the graft is better. The graft is surviving 95% to 98%. The graft survival has improved so that we could provide a better results for the patient.
And the donor area also, sir, we are placing a collagen pad plus IV glutathione.
So these all the 4 things which you have just listed, these all are very good. If we're using 0.8 mm punches, so definitely we are extracting the follicles, plus we are transecting the adjacent follicles at the level of the stem cells.
Yes, sir.
So few of them will grow there and few of them will grow here.
Yes,
so
sir.
that is also a good move.
So it's
which
like
he has been
regenerating the
taking.
donor again, even after
Exactly.
the extraction.
So that's really a good thing.
Promotes
the donor
the healing.
urea regeneration and healing of the
Better healing.
cells is very faster. So it's a very good move.
Thank you, sir.
I appreciate it.
So, sir, finally, being a celebrity hair transplant surgeon who have done like more than 4,000 cases, what did you give a checklist to a patient who are looking for a hair transplant? What should they check for?
Exactly. So this is a very good question basically. So if a person is looking for a hair transplant, it's not like hit and run. It's a surgery. It has to be done in a proper clinic. So the proper protocol is, the first thing is you should know the clinic, you should know the doctor, how many surgeries he has performed. And after doing this basic research, you can visit the clinic, you can go for consultations, you can take 2-3 opinions. It's not like that because of the social media, Facebook, Instagram, it's flooded with a lot of advertisements.
Yes, sir.
So you will not understand who is best. So sometimes what happen, people will just go for cheaper options.
Yes, sir.
So price is the main thing in the mindset of many people. But you should not go for the cheaper version. You should go for the best quality in that particular bracket. This, whatever hair is transplanted, this will remain in your scalp lifelong. Every day you will see your face.
Yes.
So to avoid all these issues in future, you should just go and research
Do your own research.
and go for the best clinic, best place, and what best deal you're getting it, you should go for it.
That was a good eye-opening session for somebody who is really interested in hair transplant surgeries. Thank you so much, Dr. Chandrasekhar sir and Dr. Divya Bharati ma'am, for sharing the hidden details.
Welcome. It was really very interesting. So it was really nice discussions. Thanks a lot.
Thank you, sir.
Thank you, sir. Thank you, ma'am.